Hello, my name is Rowan Gosi, and I'm going to be presenting the nurse case management care of the COPD patient. I will be presenting slides 6, 7, and 11, and 12. So the nurse case management patient level strategy chosen for this patient is a combination of partnership, clinical, and education. Partnership allows the patient to empower himself in making lifestyle choices and medication compliance in order to manage his COPD. It is very important that the patient understands that these lifestyle choices will benefit him in the future as far as preventing further hospitalization, as well as it is important that he is able to independently allow himself in making these lifestyle changes, as well as medication adherence. Also, another way would be encouragement. Encouragement through the nurse case management, family, partner, and friends is proven to encourage health behaviors. Education is also vital in managing COPD because the patient has already made statements that he lacks healthy stress management skills. One form of education that must be provided to this particular patient would be teaching the patient to employ cognitive behavioral skills in order to manage acute stress, especially when it arises, and to find ways to structure his life so that he may avoid or minimize the exposure to chronic stressors. As far as clinical management would involve the use of healthcare sources, as well as the management of disease through long-term. The nurse case management system level strategy would involve the use of team communication, as well as resource management from the system standpoint. Team communication and resource management allows the healthcare team to communicate with each other in managing the patient's COPD. In the patient's stay during his hospitalization, he is allowed the hospital, the pulmonary specialist, as well as a general practitioner, to be given information amongst each other in order to look at his current hospitalization, look at his treatments, and as well as prescriptions. This would allow that the team is allowed to see what this patient is doing in the hospital and how he's doing. It allows the healthcare team to plan for care in the future, and also gives the patient a source of support through the healthcare team. As far as resource management will aid the patient with smoking cessation. This would be provided through smoking hotlines, as well as a pulmonology specialist, which will also, in having a pulmonology specialist / office to go to, this patient now has the responsibility of following up appointments and making future appointments in order to manage his COPD in the long term. Through communication and resource management, the management of his COPD will likely be successful in preventing more invasive treatments, such as further hospitalization, which can get complicated. The use of oxygen and surgery would also be an invasive treatment. Moving on to the nurse case management patient level and how effective it is. Those would be slides 11 and 12, which I will also be presenting. The nurse case management effectiveness for patient level. So the patient level strategy for this patient has proven to be effective through the use of partnership. The patient is able to employ a healthy lifestyle and comply with medication management, because the patient knows that doing these will help him reduce the risk of further hospitalization, and he understands that he benefits from employing a healthy lifestyle and adhering to his medications, as well as following up with his appointments with his pulmonology specialist and future appointments with his primary care doctor. As far as education, the patient is able to apply healthy stress management skills. He has verbalized saying that he does not have healthy management skills, which is something that he lacked. Through teaching the patient how to manage acute stress, and instead of reaching for a cigarette and understanding that stress triggers him to smoke, the patient is able to apply healthy stress management skills instead of picking up a cigarette, or at least understanding that when he gets stressed, he is picking up smoking. So through teaching and coaching, the patient is able to apply healthy stress management skills. Clinical-wise, he has the support of the healthcare team. He has his general practitioner. He has his pulmonology specialist and his PMD. He also, because of this big team that he has behind him of support, he also has people reminding him of future appointments that he really needs to follow in order to manage his disease. And he is also given a lot of resources, a lot of hotlines, a lot of ways to quit smoking, because it is important that he quit smoking in order to prevent further exacerbation of COPD in the future. Lastly, he has a pulmonology specialist. This appointment was made prior to discharge. So we know that the patient is able to go home. He's stable enough to go home. And with that, we've given him the tools and the resources through partnership teaching and clinical ways to further manage his disease independently on his own. As far as the nursing case management effectiveness on a system level, it was also effective. The healthcare team worked together in planning for the patient discharge, which ensures that the patient is given the proper resources through resource management. The patient is given resources through the work of the healthcare team. The healthcare team communicated with each other in order to figure out what kind of treatments this patient has and has already received and what he should receive in the future, what medications he's on, and the type of treatments that he benefited from while he was in the hospital. The healthcare team also provided the patient with a specialist, a pulmonology specialist, prior to discharge, which we've been saying is very important in order to manage this patient of his COPD. It's important that the patient keeps his future appointments with the pulmonologist in order to manage COPD and to prevent further invasive treatments or exacerbations that would make him be put on oxygen tank or require surgery. Resource management has also given the patient many resources in stopping smoking, as well as smoking cessation hotlines. All in all, this patient was given many resources that were successful, and that the patient was given a specialist and is now being discharged. That would be all for my presentation today. Thank you for listening.